Hey everybody, this is Dr. John Degenhart. I'm a local chiropractor for almost 45 years. I started this show, Let's Talk Chiropractic, a long time ago, maybe 30, 35 years ago. I felt, and I still feel, that there is a lack of understanding of what a chiropractor does. Some people are afraid, because on TikTok there's these rough chiropractors, but there's different types of chiropractors. I feel I get very good results in this office by being a little bit more gentle. Some people think, oh, you got to be rough to get fixed. You don't have to be. Today's show is going to be special. Last week, I went to South Carolina to Sherman College's Lyceum, my alma mater, where we go for extra credits to renew our license. I took about 30 credits, multiple credits on children, babies adjusting. I've adjusted children in this office for years. But we're going to show you later on in today's show some up-to-date research about childbirth, about adjusting a one-day-old baby. And I know some of you, some grandmothers might be thinking, I don't want a chiropractor adjusting my grandchild. Come back and watch the rest of the show. I promise it'll be educational. Thank you. Now I know the concept of a chiropractor adjusting a baby, an infant, a pregnant woman. Might seem scary for some people. You know, I try to be as honest as I could. I was a guy that never believed in chiropractors. Therefore, I probably would think, isn't it scary or dangerous for a pregnant girl to get adjusted? Next week's show, we have a woman bringing in her, I think it's about a 2-week-old baby. And you're going to see exactly what I'm talking about today. So I want you to open your mind. I was a man that never believed in chiropractic. I ruptured a disc playing soccer in high school. The medical profession for 3 years failed me. I got worse and worse under their care. So when my dad said, let's try chiropractors, I remember thinking 50 years ago, aren't they quacks? Some of you still feel that way, and I respect that. I used to feel that way. Open your mind. Let's just see what we can talk about. We're going to show you some slides on statistics about the birth process. Ideally, in God's great design, an unassisted natural birth minimizes the strain on the baby and the neck of the infant. Let's talk about that. Unassisted means it's a vaginal birth, not a cesarean birth. God is wise. A woman's body opens, so the head comes out hopefully first. I used to tell Dr. Lee with the birth of our 5 children, don't pull the head. Every time there's a contraction, let the head of the baby slowly come out, catch the baby. Don't whack the baby's rear end. Put the baby on the mother. Let him suck some colostrum and things like that. An unassisted vaginal birth is when there is no forceps, no pulling, and no tugging. But let's be realistic. I'm a realistic person. Are there times that the mother is so fatigued, so tired, in so much pain that she might need some help? So what do doctors say? The average labor is about 11 to 14 hours. So let's say the doctor feels the mother's getting fatigued. We'll give her some Pitocin. Pitocin's a drug in an IV that forces stronger contractions. It will speed up the labor process. At times, is it necessary? Yes. Many chiropractors will say no. I'm a realist. I'm a man of 5, a father of 5 babies. If my wife was sitting here, she had 3 of our babies natural. As she got to be 40 years old and had 2 more children, she wanted epidural shots. So Pitocin, stronger contractions. Maybe for the mother, get the baby out of my body already, but for the baby, there are consequences. There is reflexes that are slower. The baby's reflex the sucking reflex to breastfeed is weaker. The next step, my wife again had 2 epidural shots with our last 2 children, which is and I was there. It's a long needle that goes in her spine to take away the pain of her lower body. So that, and she enjoyed it. She said there was a lot less pain. She wasn't as good a shape when she was 27 years old versus 41 years old, having our last son. But again, they used to say back then, an epidural shot does not cover the blood-brain barrier of a baby, an infant. Now research shows it does. So research, which you'll see on these slides, will show that if there's Pitocin, if there's an epidural injection, and then also a cesarean, those are things that are necessary at times, but they cause a problem for the infant. Chiropractically, I have seen multiple births over the years, and my sister Morphy was in charge of maternity at St. Joe's for years, and we have had many discussions. Many obstetricians, OBGYNs, and pretend you're them. Multiple perspectives. Those guys dedicate their lives to losing their sleep all different times of the day and night to having babies. So my respect is out for those guys. But they have very high malpractice insurance because having a baby sometimes is a risky adventure. So let's say the baby, let's say you have a 5-foot mother, a 6'5" father, an 8 or 9 pound baby. And this baby is coming out and gets stuck. And I'm sure, to be blunt, I'm sure many mothers or grandmothers or doctors watching this show can understand that scenario. So there's times for Pitocin. There's times that the doctor then has to gently. But I have seen doctors pull and twist and get the shoulder. And it's traumatizing. So chiropractically, they have made machinery to diagnose. If the baby's neck is what we call subluxated or misaligned at birth, it pinches nerves at the base of the occiput. The first nerve it goes to is to the frenulum, the muscle under the tongue. And the baby cannot suck. It's called knock tied, like a tongue that's tied. So that the tightness of the tongue, baby cannot breastfeed. So you're going to see on next week's show an instrument that measures the temperature of the baby's neck on each side. Do we twist the baby's neck? Never. We had special training. That's why I love doing this show. I never want to retire. Checking an older patient, 97 years old with chemotherapy on cancer. Checking a 1-day-old baby. Doing multiple reports for attorneys for lawsuits. There's so much to learn in this profession. That's why we do these shows. Expand your perspective of what chiropractors can do. So we're going to close up pretty soon, but so far what we're talking about, if you're pregnant, you should be under chiropractic care. If you've had a recent baby, that baby should be checked. So let's take a little break. We'll come back. Let's talk more details. Thank you. Welcome back to Let's Talk Chiropractic. We're talking about a program that I believe is going to open up a lot of people's eyes. I'm hoping there's pregnant women and young mothers that are going to say, Mom, Grandma, watch this show. I never thought that a chiropractor could check my baby. I want you mothers to look right in my heart and my eyes. When I check this baby on next week's show, look at your baby's eyes. When a baby, and I'm talking a 1-day, 2-day, 3-year-old baby even, is born pretty naturally, well, we talked about an unassisted head first baby, the doctor just catches the baby. You as a mother need to be empowered to tell this OBGYN who might be tired, who might be stressed out because he's been up for the last 2, 3, 4, or her, to say, Doctor, I recognize that, but please don't pull my baby's head. There are times shoulders get stuck, Forceps are needed. Suction or vacuum devices are needed. You're going to see on the slides during the show, the program's going to put them in for me. All of those unnatural things are necessary at times. My prayer is that we try to talk to the doctor, talk to your OB/GYN months before the baby's born, and say on that day, let's try to go as naturally as we can, meaning don't pull, but if complications arise, let's have some understanding about maybe Pitocin, maybe epidurals, maybe cesarean, maybe forceps, maybe vacuum. All those things at times are necessary, not as much as they're used in my opinion. Quick story, no names. A doctor that's a friend of mine, he did this for 40 years. He said to me once, John, and I understand this, he delivered 21 babies in the course of the week. He was tired. His friends called him for 10 o'clock tea time on the golf course. He has a woman 3 o'clock in the morning in labor. This is a man that has dedicated his life to delivering babies. Now think about it. The mother's in labor 3 a.m., 10 a.m. tea time. I'm not putting this doctor down. I must have a personal life too. I'm not going to live at this office my whole life. 4 o'clock, 5 o'clock, 6 o'clock, Pitocin. 8 o'clock, epidural. 9 o'clock, forceps. Baby's born. Doctor's off to the golf course. It's going to happen. The doctor's not going to tell you that, but you have to be realistic. These doctors are dedicated, loving professionals, but on a rare occasion, on a beautiful sunny day, does he want to be with his buddies on the golf course? Yes, he does, and that is a true story. So young mothers, I want you to understand, make a relationship with your doctor. See, doctor, if you can deliver this baby without pulling the head, without Pitocin, without epidurals. Are there times it's necessary? Yes. My wife will tell you. But again, here's what I've seen. You're going to see the statistics shown in this show. The baby's eyes look dazed. They look like they're out of it. So the Pitocin, the epidurals, the cesareans, subluxate or misalign the baby's neck. So the next thing that we see with these young babies, otitis media, which is ear infections. So we have a woman coming on the show next time. She had twins. The doctor said they're about maybe 7 months. For 7 months, these two twins had a head tilt. The pediatrician kept saying the babies were intertwined inside the woman. They'll outgrow it. They were not growing it. So they brought them here. We used our instrument, and she has pre and post pictures this mother took. So we take a temperature reading. We put a gentle pressure point. That's how you adjust an infant. Next visit, a little better. Adjustment. Next visit, a little better. 3 adjustments, 3 weeks, no more head tilt. You know if your baby was born with complications. Some baby, their APP scores are very low. Maybe the baby was blue. Maybe the umbilical cord was wrapped around the baby's neck. So as the baby's coming out, the fetal monitor starts to go haywire. So a lot of maternity nurses watching the show should say, this guy knows what he's talking about. I've been talking to mothers for decades about their birth. I want you to consider finding a chiropractor who's specially trained in adjusting babies. Many local guys, I'll be honest with you, they're not. They're more for sports injuries, more rack 'em and crack 'em. That's fine. That's what those patients need. Find a chiropractor who took special courses, special training, decades of experience, and you're going to see the beauty of adjusting this baby next week's show, of monitoring the temperature on both sides, of putting a little pressure point. Slowly the cartilage, because there's no bones in a baby's neck, it's just cartilage, it's soft. So you hold the baby. Mothers, you should feel a tone with your baby. When you hold your baby, if you breastfeed your baby, you should feel like a oneness, a relax. If your baby feels rigid, the baby feels tense, the baby's colicky, gassy, always crying, I'm telling you, there's a spinal misalignment that occurred probably during the birth process. So let's wind it down. I know some of this you're going to have some doubts about, but I'm telling you, I wish you could see what I can see. Take a little break, go change your baby's diaper, come back, we'll talk about the third segment. Thank you. Again, I thank you for spending time with me. Time is a valuable asset that God has given us. So I try to make these shows heart to heart. And again, I'm probably challenging some of your views. What we're talking about, the more natural the childbirth can be, head first, unassisted, meaning the doctor just catches the baby, the less trauma to the child. Many births though, the doctor might be in a hurry. The mother might be tired. So therefore, Pitocin, epidurals, forceps, vacuum, all these things are assisted where the doctors say, oh, it's fine. Not really. The average pressure that a doctor pulls on a baby's neck, they found, is 29 pounds of pressure. A whiplash car accident, to give you an idea, is 57 pounds of pressure. So an adult whiplash, 57 pounds. But that baby, that neck is, you know a baby's neck, it can't hold up the head, it's so weak. 29 pounds of pressure. Forceps, 42 pounds. Vacuum devices, 57 pounds. So the baby has a whiplash injury at birth. Have your baby checked if you see any kind of, if the eyes are unequal, if the eyes just look so dazed, like they don't even know what their environment is like. It's a beautiful thing to see that a baby's eyes that just look so in tune with nature, even as a young infant. They don't have to be 6 months old. I want the patient to get empowered to say this makes sense, that the birth process was supposed to be natural. And don't get me, I've seen births. What if an arm comes out first or a leg? Does a woman need an episiotomy? Yes, where they need to cut the woman to make her wider. I'm not challenging the medical profession. I'm just saying you, as a pregnant woman, become more knowledgeable, because most pregnancies, they say about 90% are no problems. There are times where there's a placenta previa, where there's a lot of blood. So some people, some chiropractors have their babies at home. My wife and I respected her. We had all of our babies in a hospital. None of our babies had complications. So some of you have midwives, doulas. I'm not against that. Many midwives are very knowledgeable. They have babies in a bathtub, have babies at home. I'm all for that, as long as you're knowledgeable and you have someone there in case an emergency does happen. Most childbirths don't have those complications. But we're not talking about bad, the 5%ers. We're talking about pretty much normal births. Normal to me means vaginal, not cesarean, no forceps, no vacuum, no pulling. Your baby will be unsubluxated, proper nerve supplies, and you're going to see it on the films or the charts. There'll be a better sucking response. Ideally, breastfeeding, I think, is the way to go. It's cheaper. Formula is expensive, and I've seen these babies. You ever go to one formula to the next? These babies, there's so many chemicals in formulas. But yet, let's be honest, from the mother's point of view, do all girls like breastfeeding? No. Some girls have told me, if I can be blunt, that their nipples crack. They try to put Vaseline, or the baby doesn't suck properly. My point to those mothers, maybe if the baby's adjusted gently, the baby's frenulum, the tongue will work better, the baby can attach better. Ideally, it should be a very beautiful bonding experience. The researchers show they should breastfeed up to 2 years old. I've had girls say in 2 or 3 months they got tired of it, or they didn't have enough milk, or some women breastfeed. I was in my waiting room, a girl had her shirt open, a 6-year-old little boy was standing there breastfeeding. So some girls do it longer, but what they suggest is 2 years or less. to get enough antibiotics and help the digestion. You can, again, give some food along with the breast milk. Some girls, they pump and they'll put it in a bottle. So whatever but ideally, the breast milk is better for the baby than any kind of formula. Society is making the beautiful natural birth so mechanical anymore. Let's shave the woman in a sterile environment, bright lights, cold, slap the baby. Formula is fine. I think from God's perspective, why does a mother lactate? For all these years, God's intention was for the mother to breastfeed. Some girls, if they don't like it, that's okay. Don't make them feel guilty. Don't make them feel like they're unnatural. But for a woman who wants to breastfeed, she should say, I want my baby to have better frenulums so they can suckle on the nipple and connect properly like they're supposed to. So chiropractors, we adjust pregnant women. Next week's show is going to be a girl who came under my care while she was pregnant. I must have 80 girls right now that are pregnant. They come here every month because it's hard to get in and out of a car when you're 7-8 months pregnant. It's gentle, it's safe. Then they bring their babies to see me. They can't wait after the childbirth for me to do my temperature reading. You can't feel the bones. So there's an unequal temperature reading. Quick story before we end. A nurse came to me once. She was upset by this kind of talk. She brought her baby, though, after 5 different ear infections, where the pediatrician kept saying, multiple antibiotics. We don't know why the baby's ear canal isn't formed properly. She had a forceps delivery. We put a pressure point. Ear infection stopped. I was shocked. That nurse who was against me, she loved that her son never had any more ear infections. And I saw her years later. He is now a chiropractor in New York State. So when you're here 45 years like I've been, you see the big picture. May God bless you. I want you to have a beautiful, long, healthy life. Earlier that baby's checked, the better.